Demystifying the world of data and embracing the potential to transform communities went to the heart of this year's Health and Social Care Gathering in Stirling. Taking place against a backdrop of public health reform, people this year were firmly focused on using data to address health challenges and driving down inequalities.
If we put community at the heart, people at the heart of our design of information and even the insights, the data that we have will start to paint a different picture because we will be narrating it in a way that anybody and everybody will be able to understand.
A common theme emerging is the need for greater recognition of the vast amount of data and experience generated by partners in the third sector, which it's felt could complement existing national intelligence.
The hyper-local, community-based data, crowdsourced data, citizen science type data approach, and actually I think the blend of the highly structured, highly formalised and the local type information is for me one of the best ways to really understand what is relevant to that community.
This comes as the Scottish Government has already signalled a shift from GDP to wellbeing to measure the national economy. One of the main areas facing charities, which still needs to be addressed, is measuring the impact of work that's transformational, but that doesn't always lend itself to easy measurement.
We're very good at the moment at measuring activity, of measuring outputs. We can measure inputs to some extent and we can link inputs to outputs, but what we are struggling with is the measurement of meaningful outcomes. And that I think is an area where we are going to have to sort of up our game.
Maximising the impact of available data will be central to the way Public Health Scotland operates with partners across the country. The new organisation is set to launch in April 2020.